This is our ethical dilemma group presentation, and we are doing it on the elder population. And this presentation is by Matt, Cameron, James, and Amir. So the case we're discussing today revolves around a conflict over an advance directive in an elderly patient. Our patient is a 93-year-old male with end-stage heart failure paired with advanced COPD progression. Our patient was recently admitted to the emergency department and then transferred to the ICU following an episode of acute respiratory failure. The following day, his condition progressed as a result of extended periods of severe hypoxia, which eventually led to significant alterations in mental status and decision-making capacity. 8 months prior to this current admission, our patient formed an advance directive with his primary care doc and social worker. This directive is considered legally binding and states a clear refusal of advanced interventions being carried out in the event they are necessary for the patient. These interventions include refusal of being intubated and placed with invasive tubes and lines that would be used to supplement nutritional intake, or putting the patient on a vent or anything related. In the chance that any of these advanced measures are on the table, the patient stated they request a more palliative care approach. The ethical dilemma presented itself when the patient's son, who also happens to be his designated proxy, as stated in the advanced care directive, began to lean towards and request more invasive and aggressive treatment options. These include some that were clearly stated for refusal in the advanced directive. The son's argument for these interventions is that he did not expect his father to deteriorate so quick, and that his father would likely want these advanced interventions involved due to the speed at which his condition progressed. This dilemma has resulted in a conflict among parts of the healthcare team, in which some members feel the need to follow the advanced directive as it is stated, and other members leaning towards the side of the son and believing the perceived needs and wants of the patient. The two ethical theories I think fit well into this case are deontology and utilitarianism. Deontology is described as a duty-based theory where it kind of states that morality surrounding an action is through following a set of duties. In this case, it would be the advance directive, and it does not prioritize the consequences of the case as much. And I chose this theory because it follows the side of the healthcare team that wants to uphold the advance directive as it was stated, because it is what respected the patient's autonomy the most, as it was made before the mental status alteration and therefore seen as a competent decision made by the patient. I think this represents the diverse ethical nature of the case because it sides with following the patient's wishes when the patient can no longer speak for themselves and their proxy is saying a different opinion. This, while the healthcare team struggles with the decision to either follow their duty to uphold the directive or to empathize enough with the proxy to disregard the legal status of the document. The other theory I think is relevant to the case is utilitarianism, which is described as looking to choose a side of the best outcome or greatest good. This theory takes more consideration into the consequences as it relates to the morality of action. This can be seen as leaning more towards the proxy side of the argument, where in a perfect outcome, after all the advanced interventions were imposed, the patient would recover and the son would not have to grieve the loss of his father yet. I chose this theory because it considers the consequences regarding the team if they should follow the directive or not, and pulls the ethical issue of this case together for all the stakeholders involved, such as the proxy, healthcare team, patient, and hospital itself. I think this theory represents the diverse ethical nature of this case because it takes into account what might happen if they choose to follow the proxy or not, and what consequences for doing either or, such as the legal concerns that surround the patient's care, not be taken to the full extent if they do follow the proxy, or if they don't follow the proxy, like all the liability concerns of disregarding a legally binding document.
So let's take a look at the key stakeholders involved in this case. First and foremost, the patient is our primary stakeholder. He clearly outlined his wishes in legally binding advance directives, refusing aggressive treatments like intubation, feeding tubes, and mechanical ventilation. Those wishes should guide the care that he receives now that he's unable to speak for himself. The next stakeholder is his son, who also happens to be the legally designated proxy. Although he's the official decision maker, he's now requesting aggressive treatment, something that the patient specifically declined. This introduces a conflict between honoring the patient's documented preferences and the son's current requests. Next is the healthcare team, which is also heavily impacted. They're split, and some believe in strictly following the directive, while others empathize with the son's perspective and question whether the directive still reflects the patient's current needs. And then finally, we have the hospital and legal team, who must consider legal liability, risk management, and compliance with state institutional policies. So each of these stakeholders have different roles and responsibilities in navigating this complex situation.
Now we need to look at the ethical implications of each stakeholder's position using both the deontological and utilitarian lenses. Starting with the patient, from a deontological perspective, the focus is on representing their prior stated wishes and preserving autonomy, regardless of the outcome. From a utilitarian view, there is consideration that survival might still be possible, but also risk of prolonged suffering if interventions go against their values. For the son, the deontological duty is to uphold the directive as it was written, not reinterpret it based on emotion or new circumstances. But, from a utilitarian angle, he is trying to seek what he believes is the best outcome, even if that risks overriding his parents' autonomy. The healthcare team has a deontological obligation to follow legal directives and avoid unethical care. However, some may lean towards the utilitarian view, wanting to maximize benefit, prevent harm, and reduce family distress, even if it means questioning the directive. Lastly, the hospital is responsible for ensuring legal and ethical compliance. From a utilitarian standpoint, they must also consider potential liability, cost of care, and maintaining public trust in honoring advance directives. Together, these perspectives highlight the moral complexity of the case and why ethical clarity is so important in guiding action.
The historical case that's related to our ethical dilemma was nationwide news, and political candidates and the Supreme Court all weighed in on the decision on it. So the historical case is Terry Servino. So Terry Servino suffered a cardiac arrest on February 25th, 1990. She was resuscitated but had severe hypoxic ischemic encephalopathy and never woke up from her vegetated state. She had no advance directive written, and her husband Michael, by Florida law, was made her surrogate decision maker. For several years after her arrest, Michael and her parents lived together and they pursued aggressive treatments trying to revive Terry. However, this relationship fell apart, and the parents petitioned that he be removed as her surrogate. The court ruled that he had not abused her and sought the best treatment for her and should remain as a surrogate. In 1994, however, Michael began to believe she wouldn't recover and recalled Terry had expressed to others and to him that she wouldn't want to be kept alive on life support if there was no hope for recovery. At this point, he requested the court to authorize a right to refuse the feeding and hydration tube that was keeping her alive. The ethical question that got raised in this is, are artificially administered hydration and nutritional needs medical treatments or mandatory basic care? After a long, lengthy legal battle, this ended up in the Supreme Court, and they ruled that they are medical treatments due to the advances in technology required to perform them. In previous court cases, they determined that patients had the autonomy to refuse life-saving treatments, and in this case, because she could not make that decision, Michael was able to make that decision for her. with the exception that if Terry hadn't expressed it, they would have sided on the side of life and they would have prevented it. This court case and the feeding tubes were stopped and started several times back and forth during the legal battle, and it all ended on March 31st, 2005, after the feeding tubes had been removed for a few weeks and Terry died.
To conclude, applying ethical frameworks like deontology and utilitarianism shows us that there are many righteous ways to view this scenario, each grounded in different moral values. One of the central tensions is the conflict between autonomy and perceived best outcome. On one hand, we have a clear, legally valid advance directive that reflects the patient's autonomous decision to refuse aggressive care. And on the other hand, the proxy, driven by love, fear, or hope, believes that overriding those wishes might offer a better outcome. This raises deep ethical questions. Does honoring someone's past decision always take priority, or should we adapt to new circumstances, especially when life is on the line? There's also the pull between legal duty and emotional distress. Clinicians feel torn between what the law demands and what feels compassionate in the moment, and uncertainty complicates everything. Was the advance directive still aligned with the patient's values? Did their condition change in ways that they never anticipated? In light of these complexities, it's critical to honor what is legally valid while also clarifying the limits of the proxy's authority. The role of a proxy is not to rewrite the patient's wishes, but to uphold them, even when it's hard. Finally, situations like this are exactly why healthcare teams need to lean on institutional resources, ethics committees, legal counsel, and structured family decisions to navigate difficult decisions in a way that's both ethically sound and emotionally compassionate. This case serves as a reminder that clear communication, early planning, and a shared understanding of patient values are essential for ethical